Hi, I'm Cathy Elliott and I'm Chair of NHS West Yorkshire Integrated Care Board, the ICB, and I'm Deputy Chair of our Health and Care Partnership. And I wanted to share with you some of the work that we as the ICB board are undertaking at the moment to make sure that people are at the heart of our decision making. And as you know, we as a partnership since 2016 have had a commitment to this, making sure that local people are at the heart of planning, decision making and the transformation of services. And we have had for a long while our involvement framework, which is building on the ways in which we work across places and services. You may know about the Cancer Forum that we have. We have the Maternity Voices Forum as well, where women and their families can come together with midwives and doctors and look at improving services together. And then we have lots of things that go on in places as well, which you might be familiar with: the Wakefield Big Conversation, the Big Leeds Chat, the Bradford District and Craven Listen In, Calderdale Engagement Champions and Kirklees Community Voices. So we're really good at this in our system, and I wanted to complement that through the work of the board as well for the ICB. And what we've had since September last year is a commitment as a board to put people at the heart of our decision making. I'm grateful to all 24 board members for committing to this and carrying on what we've done for many years as a partnership. But in particular, our Health Watch board representative, Hannah Davis, who represents all Health Watch organisations across West Yorkshire, and also our non-exec member for Citizens and Future Generations, Becky Mulby. And you can have a look online back to the September board meeting about the recommendations that came forward for us as a board to come together and make sure that we're visible and we're engaged and we're committed to this. And since then, we have had sessions on each of our board days that happen every 2 months in public, where we meet local people and hear from Health Watch about people's experience, the good and the not so good. And then in the board meeting, we then look at that service or that sector and the ways in which we can help it in terms of its sustainability, improving its service delivery, quality improvement, innovation, and any policy changes that we need to look towards, and what we can do as an ICB to add value, but also where we need to go to others such as NHS England. So back in November, we were in Huddersfield and we met with a group of local people to share with them the good and the not so good experiences of GP services. And I spoke to a woman who shared with me her experience of accessing care from her GP for mental health support, and that she was signposted to a voluntary community and social enterprise sector organisation, a VCSE organisation, who provided her exactly the support she needed at that time. But she said to me that she knew that if she was in crisis, the GP was there for her. She also shared with me that the services for her mother were not so good. And this gives us insight in going into a formal board meeting to then make the right kind of decisions with the voices of local people very recently in our heads as we have those conversations. In January, we had a focus on workforce in Leeds, and I met a lot of people working in the independent sector and in social care and pharmacy as well, to understand their experiences and how we integrate and connect services together. In March, we had a focus on VCSE sector sustainability, and I met local leaders who wanted to make sure that their anchor organisations providing health and wellbeing support in neighbourhoods could continue, and talk through how they can connect better with local authority and NHS services. And this was a really good experience for all board members to come and have those informal discussions to work out how to improve services. And then we heard from Kim Shuttler, who leads on Power of Communities work for us across West Yorkshire, on what we can do as a board and what we can do in places. Our May meeting looked at oral health and dentistry. We were literally a matter of weeks into taking on the commissioning of this across West Yorkshire. And Health Watch supported us in hearing about the really frustrating experiences people were having in accessing an NHS dentist and the kind of care that they wanted to try and receive. And again, that was so helpful as we look together in improving those services, how we can be more proactive in commissioning and resourcing. And that then connected with our partnership board meeting with local authority leaders and VCSE leaders to look at data sharing, prevention and policy changes that we needed to take together. And so lastly, our next session to share with you is in July. It's on the 18th of July in Batley, and we're going to be looking at integrated community services. And again, we'll be working with Health Watch to hear firsthand about people's experiences of the good and the not so good, and how we need to work together to tackle inequalities, improve access, and importantly, offer that seamless access to care for people close to home or in their homes, which we are all committed to doing, but we need to make it a reality. And that's what that session is going to be about, as well as looking at it in the board meeting. And if you've got any ideas on how our ICB board can come out and be visible and present and engaged, please let us know. We have a visits programme in development. We're doing a session on mental health in September. All ideas are really helpful to us to make sure that we've got people at the heart of our decision making. And very lastly, I wanted to share with you our West Yorkshire Voice Forum. This is a way in which people who are already engaged with their services or organisations like a GP patient forum, a governor at a foundation trust, an active member of Health Watch, or anyone else can come and get involved at a West Yorkshire level, share their lived experience, and also be up to date on the ways in which we're working and the decisions that we're making. So please promote West Yorkshire Voice far and wide, and we hope we can build the membership of that. Thank you so much for all you're doing. These are really precious times. Thank you again for everything that you're doing, and please take care.